Everybody high. Artificial intelligence AI is going more than automatic administrative task. It is fundamentally reshaping medicine. We are witnessing a transition from a practice grounded primarily in individual experience and population averages to a data-driven, adaptive science focused on the specific biology of the individual. Instead of simply digitizing existing workflows, AI is enabling entirely new ways to visualize disease, predict risk, and design interventions, capabilities that were previously impossible at the human scale. From experience-based to data-driven care. For most of modern history, medical advances rely on slow, incremental trials and the accumulated judgment of individual experts. AI disrupts this model by extracting patterns from vast multidimensional datasets, including electronic health records, high-resolution imaging, genomics, and real-time sensor data. By processing information no single clinician could even synthesize alone, AI turns routine clinical data into a continuous engine for discovery. New diagnostic and computational phenotypes. Deep learning systems are redefining diagnostic precision. This model can detect subtle radiologic, pathologic, and retinal features that correlate with disease risk long before symptoms manifest. In doing so, they are defining new computational phenotype categories of disease visible only to the machine. Systems do not just replicate human vision, they reveal latent structures in images and signals, fundamentally altering how conditions like cancer, cardiovascular disease, and neurodegeneration are classified and staged. Predictive, personalized, and preventive. Medicine has historically been reactive, managing crises after they occur. AI shifts this paradigm by combining clinical variables with genetic, environmental data, and behavioral insights to estimate individual risk trajectories. These models the standard of care from broad risk categories to precise, personalized predictions. The result is early intervention, precision drug selection, and dynamic treatment adjustments, creating a healthcare model that is preventive and continuously optimized rather than episodic. The rise of learning health systems. AI is enabled to the creation of learning health systems where every patient's encounter fits a global model that updates continuously. This blurs the traditional line between rigid clinical trials and daily practice. Concepts like digital twins, virtual simulations, and individual patients allow doctors to run rapid, low-risk explorations of what-if scenarios, testing treatment strategies in silico before exposing the patient to new approaches. Ethics and the redefinition of expertise. This new science raises profound questions about bias, transparency, and responsibility. When algorithms influence life and death decisions, who is accountable? Rather than replacing clinicians, AI is redefining what it means to be an expert. The most effective physician of the future will not just be encyclopedias of medical knowledge, they will be interpreters who can interrogate models, understand their limitations, and integrate algorithmic insights with human values, empathy, and ethical judgment. Thanks for likes and sharing.